The Big Whack presents Buffalo on the Rise, sponsored by Dr. Kaplansky Dental Implants. Get new permanent teeth in 24 hours with our exclusive Teeth Now process. Welcome to the television show devoted to local business, Buffalo on the Rise, with your host, Joe Chili. There's an entrepreneurial spirit in Western New York that's putting our area on the cusp of greatness. Each week, Buffalo on the Rise features local business leaders and decision makers who are shaping our future. If it's about local business, we'll talk about it right here, right now, during Buffalo on the Rise.
I'm Joe Chili. On this edition of The Big Whack presents Buffalo on the Rise. How does your summer smile look? Dr. Kaplansky is here to answer your questions about dental dilemmas. Do you have questions on how to handle healthcare costs as you get older? Our expert from Summit Healthcare Solutions has answers that will save you money. Then, are you thinking of slimming down this summer? Our diet mentor has great advice on how to eat right, get moving, and look your best. All on this edition of The Big Whack presents Buffalo on the Rise. I'm Joe Chili. You can listen to me mornings on The Big Whack. Joining us today on The Big Whack's Buffalo on the Rise is Dr. Kaplansky, and I want to welcome you to the show today. I'm impressed by some of the things I see about you. You know, we do background, obviously, before we do a program like this. So I wanted to look up some things about you. First off, you started in business with a friend of mine in Niagara Falls, which was a while ago, but all of your certifications and things like this, you'll have to explain some of these things to me, because if I look up dentists in general, I see a couple of things. Graduated from here, did work here, or whatever, but you're board certified in implant dentistry, diplomat of the American Board of Oral Implantology, Fellow at the American Academy of Implant Dentistry, Fellow International Congress of Oral Implantologists, Fellow Academy of Dentistry, Certified Zaga Center, which is kind of like a mystery to me. We'll have to ask you about that. But what do all these things mean? To me, this means that all dentists are not the same, right? I mean, but when you start looking at all these things, how long did it take to get these? And was it something that you planned originally, or did you say, these are the things I'm going to go for as far as certifications?
Well, first of all, I'd like to thank you for inviting me
Sure.
to the program. It's my pleasure to be here with you. It's a lifelong journey, really. This obviously took years to accomplish. And unfortunately, that's what we see often now in practice, is many younger dentists just fresh out of residency are doing these procedures, and they probably don't have enough experience yet to perform them.
When you start talking about things, and you start talking about implants, because it's something specifically that you do, is there something that they teach you in dental school with regard to implants? You know, something that all dentists do. And how did you move past that to come up with your own Teeth Now method?
Absolutely. So in dental school, you get some really basic rudimentary kind of education on all aspects of dentistry, on all the different procedures. So they can't really focus on anything too in-depth. And then after you graduate, that's when you expand your knowledge, then you kind of go more into the areas of your interest. So my area of interest was dental implants, and I really wanted to get much deeper knowledge in that area. And that's how it all happened.
Dental implants, and I have a very basic knowledge of these things, so I'm going to ask you, but you know, you start thinking about things like bone grafts and the prep work that goes into this, and it sounds very invasive to me. And as just a normal individual, I like to avoid pain.
Absolutely, yeah. We all do.
So I mean, you probably look the same way. You probably looked at this and said, there's got to be a better way to do this procedure.
True. So traditionally, dental implants aren't new. So they've been placed routinely for probably about 30 years now, with a lot of data, a lot of research, and it's backed up by science. Now, traditionally, the thinking in dentistry was that you have to prep the site first. So if the site or the bone in the area is deficient, you have to build it up. And how do you build it? By grafting bone, either from a donor or from animals. You would take the bone, graft it in the area, and then grow the bone, then place the implant. So that basically means multiple procedures, multiple surgeries, a lot of time and healing, discomfort, obviously, and patients, had a very, very long journey for absolutely no reason. So what we did, again, based on the current research and the modern science, is we changed the tactic a little bit. So we looked for solid native bone instead of using grafted bone that unfortunately a lot of times later turns into mush and it's not even usable. We use patient's native bone, which is stronger usually, doesn't require additional surgeries, and gives us better and faster results.
Is it a long, involved process?
The Teeth Now procedure that we kind of created is very streamlined. You literally, in 24 hours, you take patients from either no teeth or decayed, non-restorable teeth to permanent teeth, 24 hours.
Is it something that lasts the entire life, your entire life?
It can. It depends on a lot of factors. Most, again, scientific research shows us longevity of dental implants anywhere from 15 to 25 and more years. But a lot of it depends on patients' general health, which can change throughout their lifetime, and also on the maintenance, on care and maintenance. So we do insist that patients come back for routine hygiene so we can check things and clean things.
Are you trying to tell me that people don't generally take care of their teeth?
Sometimes they do.
You know, flossing is a big thing. You're trying to keep your teeth. Right. I think that this is fascinating in itself. I think the fact that it's less invasive, your procedure, is a big thing. Not just, for myself. I mean, I hate to sound like, oh my, I don't want to have to go through this, but, I had parents and grandparents that went through dentures, and many, many different kinds of dentures, and dentures that didn't seat right, and dentures that were constantly slipping, or whatever the case may be. So
we see it very common. It's a very common experience. Patients really hate their removable appliances. So I'm yet to see a patient who is happy with their denture. So that was another push in creating a process that would give people permanent teeth. So the teeth that they wouldn't have to remove every day to clean. Teeth that wouldn't hurt them when they chew, teeth that wouldn't fall out when they laugh. That's what we did.
So if you hate your removable, appliance, you'd want to give Dr. Kaplansky a call. Dentistry by Dr. Kaplansky, 8038 Rochester Road in Gasport. Phone number 716-772-7500. drkaplansky.com is the website, drkaplansky.com.
Sponsorship and promotional consideration for the preceding segment was provided by the following.
Hi, I'm Joe Chili, mornings from 7 to 9 on Buffalo's oldie station, The Big Weck. Joining us on The Big Weck's Buffalo on the Rise today is Darlene McClay, who is with Summit Healthcare Services. I understand now you were a nursing home administrator. Also, you're a certified Medicaid planner, correct?
Yes, I am.
That sounds like a very important position. I mean,
Well, I don't know if it's important, but it is helpful for families.
Because I have to tell you, Medicare, Medicaid, it's like alphabet soup for me. And maybe for some individuals, you have people that just come in to say, specify what the two are. Now, you just work with Medicaid specifically, right?
Correct. We just work with people who are either in or going into nursing homes or assisted living. They are running out of funds, or they have run out of funds, and they need to apply for Medicaid in order to continue to live in the facility.
How long ahead of individuals going in, should they do this? Is there such a thing as pre-planning? You know, I mean, should you go in when they're 60? Should you go before that? And I know that there's a look-back period too. You might want to mention that.
Yeah, applying for Medicaid does take a 5-year look back, so it's very time consuming. You have to collect all of the documents, you have to collect all of the bank statements, the annuity accounts, all the pensions. So our files are quite large, and they take a while to prepare. The problem is, though, is that people can't start too early. So we do have people who call us very early and they just want to anticipate, but we don't want to take individuals' money unless we can provide them a benefit. And so you can't qualify for nursing home Medicaid or assisted living Medicaid until you're actually in a facility or going in a facility. So we tell people that that's the time to call us. And even if you have too many funds to qualify for Medicaid, we've been doing this for over 20 years. For probably the first half of it, when people would have too much money, we would basically say, oh, you have to be private pay for another year, and then call us. And they would walk out the door, very confused, very frustrated. And we finally learned that we actually could become certified Medicaid planners, and we could provide a service to these families who have extra money and help them understand what the qualifications are for Medicaid, what resources are exempt, which ones are not exempt, how we can help them become eligible sooner. So our goal is always, when a client leaves our office, they feel very comfortable, they feel very confident, they know they've spoken to somebody who's very qualified. Our organization represents over 1,000 people a year for this benefit. So we're the largest provider, but our services are 100% guaranteed. If you're qualified for Medicaid, we're going to get your loved one Medicaid.
You know, and there are some different types, like you can maybe you're in home, people want to stay in their home, people go for assisted living, or maybe they have, have to take care of everything or whatever the case may be. And I understand that the costs of like nursing care or being in a nursing home can be what, $13,000, $18,000 a month?
Yeah, it's going up quite a bit, but I would say the average is probably like between $15,000 and $16,000 a month. So people end up going through their money quite quickly. So we tell people all the time, when you are admitted into a facility or when your loved one is in a hospital and they've told you that they need to go into a nursing home or an assisted living, that's a good time to call us. You can call our offices. We answer the phone. It's not an auto attendant. Somebody will answer it from 8:30 to 4 o'clock every day. And if you have any questions, we're happy to help you out.
If we have viewers that are in other states, do you help out in that situation too?
We do. We started just serving Western New York. Then, since this, as I said, over 20 years ago, we've then grown to go all across the entire state of New York. And now we represent individuals from 12 or 13 states. So if anybody has a loved one who doesn't live in New York and they're in the same situation, they can call us. We can apply in any state in the U.S.
Besides Medicaid, do you provide any other services?
Well, we do Medicaid planning, but our only business is Medicaid. We tell people that Medicaid, it's all we do. So we specialize in it. We answer anybody's questions. So we can help you qualify for Medicaid sooner by doing some Medicaid planning, or if you're ready to qualify, we'll do all the work so you don't have to. You know,
and the other thing that you mentioned, and you mentioned it in your commercials as well, your services are 100% guaranteed. How can you guarantee something, 100%, and what does that guarantee cover?
Well, the interesting thing is that most people who do Medicaid applications for their loved ones on their own, and when I say most, it's pretty close to 50 or 55%, the applications get denied. And they get denied simply because the family is too busy to meet the deadlines, too busy to figure out how to get the documents. So our guarantee is that if your loved one qualifies, we will do all the work. We will make sure that all of the documents are delivered. We will make sure that they're there on time. We'll make sure that the decision that Medicaid provides for your loved one is the accurate decision. So if they qualify, meaning that they are within the resource limit, we will get them Medicaid 100%.
So it really is. I mean, when I think about these kind of things, my hands kind of sweat. You know what I mean? So it really does take a load off the mind of individuals. And then the other thing is, families that are dealing with a situation like this, just as you said, can be so frantic. They don't know where to turn. So you are that place to turn.
We are that place. I would say probably 15 to 25% of our business are families who have either started the process and can't finish it, they're overwhelmed, or they did the process and they got a denial. For no reasons that the person was not qualified, it was for reasons that they didn't fulfill the verification on time. And now you have to start all over. And when you start all over, you miss a lot of times. When you start all over, Medicaid will only go forward. So, you know, if you have an application that was pending for 9 months and it got denied, that's a big bill that's owed for the nursing home. So for most people, when they come to us, they say either, thank you so much, I'm so glad I heard about you, or how come somebody didn't tell me about you when I started this process, because I would have never put myself through this.
Well, we told them a lot sooner today. Darlene McClay, thank you very much from Summit Healthcare Services. For more information and answers to your questions, contact Summit Healthcare Services by calling 716-332-6487 or go to medicaidbysummit.com. Sponsorship and promotional considerations for the preceding segment was provided by the following. Hi, I'm Joe Chilling, mornings from 7 to 9 on Buffalo's oldie station, The Big Weck. Joining us on The Big Weck's Buffalo on the Rise today is Sherry Zilio, who is from Diet Mentors. Sherry, how are you today?
I'm doing well. How are you?
Good. I'm glad that you have your name on there so I can look. I knew that who you were right off the bat. And, you know, I think that, you know, dieting is a big thing with folks now. And I hear people, well, I hear the ads all the time for the shots that you can get because this is America and everybody wants immediate gratification. Sorry. And nobody wants to work for it, you know, but that's not such a great idea, I understand. I mean, there's a lot of, I know people that have, you know, done, I won't mention them by name, but some of the things, the shots, and have had very bad side effects from it. And they may not be life-threatening side effects, but they're inconvenient, let's put it that way. Can't leave the house type side effects.
Right. Very inconvenient. Weight loss is a lifestyle change. There's no quick fix. There's no magic pill. Even when you go off the pills, you end up gaining your weight back. And like you said, all the side effects, no thank you. Come see us and let us help you. And we don't just help you lose the weight. We continue following you to make sure you keep it off. That's the hardest part.
Well, that's the thing. I mean, you know, people go on a diet. And then they, you know, then they can go on like maintenance or whatever they call it.
Right.
And the maintenance program is kind of like, because sometimes it starts to come back slowly.
Right.
And so what makes Diet Mentor different, I guess, is my question.
So once you reach your goal weight, we teach you the Mediterranean diet, which was voted again, I think the 6th year in a row, the best diet to follow for best health and longevity. Lowest rates of cancer, heart attacks, all sorts of other ailments that people have, you know, the high blood pressure, diabetes. So once you get to your goal weight and we teach you the Mediterranean diet, you still check in with us. We're gonna hold you accountable. You hit that 10-pound weight loss or 10-pound weight gain, come back and see us, get back on the program. We teach you to take immediate corrective action if you put a little weight on. Don't wait till all your weight comes back. You know, we do have some people that do that and they come back and they have regret that they did that and they didn't come in for the check-ins.
So you're constantly on the scale?
Yeah, you should.
Really?
Yes, absolutely. You should weigh yourself once a day or at least once a week. Once a week is better because we all, you know, your weight fluctuates. It could be water weight. It could just be you went on vacation and you overindulged a little bit, but now you're back on track. But I would say at least once a week.
Now, the Diet Mentor program, do you have specific food that individuals eat? You talk about the Mediterranean diet.
Right.
You know, but do you provide the food?
The Mediterranean diet is once you get into maintenance.
Okay, I see.
When you're in weight loss, it's a partial meal replacement plan, meaning you're gonna eat half of our yummy protein products and half of your own food, healthy food. The reason for the protein products, we want you to feel satiated. We don't want you to lose muscle. Protein is key for, you know, cell turnover and everything. So you don't eat our food forever. It's temporary. You have to be very diligent to lose weight and you have to be in a calorie restriction. So we're gonna help you with that. Plus, we have a great variety. People love our food. Nothing can be purchased in a store. And people just love coming in, actually for the coaching. They all say the same thing. It's the structure and accountability. I need to know exactly what I should eat and I wanna come in and report to somebody. I want to be held accountable. People say it all the time. And that's what we offer. That is the magic. The food isn't magic. It's a tool to help you enjoy your dieting process.
So who is it good for? Are we talking individuals that are diabetic, pre-diabetic, somebody that just wants to lose 10 pounds, 20 pounds?
All of the above. So a lot of people have the diabetes, even type 1, type 2, high blood pressure, high cholesterol, kidney issues. If you want to improve your health and lose some weight, come and see us. We have helped people that thought that they could never do it. Grown men have cried saying, I cannot believe I'm at this weight again.
You know, what about individuals that are being treated, say for type 2 diabetes, and maybe they're on some medication to lower their blood sugar, whatever the case may be. How do you make sure that someone that's on your diet doesn't drop too low? Or how do you keep track of the blood sugar? You know, do you have a doctor that you consult, or what happens?
They actually should stay in contact with their doctor.
Okay.
If they start feeling funny, like people with blood pressure and diabetes, if they start feeling a little funny, that usually means that now you're over-medicated. Talk to your doctor. A lot of people either reduce their medications or go off. And that happens very quickly with diabetics and high blood pressure patients.
If I feel funny, I'm going to do stand-up comedy. I think
You
I'm
could
going
do
to
that too.
just drop TV and just do stand-up comedy.
Right.
All right. So if individuals want to get started, they're watching today.
Yes.
But they say, I want to know more. I want to see some more about it. Or I want to talk about it. Don't want to initially just sign on the dotted line. What do they do?
Come and see us for a free info appointment. It's 30 minutes. Everybody's different, and we really do like meeting with you one-on-one to hear what you've tried. What is your medical history? What medications are you taking? What didn't you like about what you've tried before? How our program works, cost, everything. We cover that all with you.
And work better for male, female, age groups? Is it right across
It
the board?
doesn't matter. It's repeatable, predictable weight loss. Although men lose more weight than women because you all have more muscle. So typical weight loss for men is 3 to 5 pounds a week, every week. For women, it's in the range of 2 to 4. If you do our low-cal, low-carb program, it's going to be a little bit less, but not much less.
You know, when you start thinking 3 to 5 pounds, you know, I keep thinking if you lose a pound a week, it's good because of the fact that maybe you can sustain it longer.
Yeah.
But it sounds like a great program, so I really appreciate it. Again,
Yeah.
Sherry Zilio, Diet Mentor, thank you very much for joining us today. For more information and answers to your questions, contact Diet Mentor by calling 716-500-DIET or go to dietmentor.com. Sponsorship and promotional considerations for the preceding segment was provided by the following.
Thanks for watching this edition of The Big Wack Presents Buffalo on the Rise. For information on this and other shows, go to our website, bigwack.com, and find out how you can participate on the program if you're a hometown business. I'm Joe Chili. Thanks for watching and listening to The Big Wack, Buffalo's oldie station.
The Big Wack Presents Buffalo on the Rise was sponsored by Dr. Kaplansky Dental Implants. Get new permanent teeth in 24 hours with our exclusive Teeth Now process.